Good evening, everybody, and welcome to another of our webinars. This week, we have an introduction to podiatric acupuncture, and we're joined by Somuz Miah, who is our host this evening, and also David Lintonbon. So if obviously this is going to be recorded as we usually do, and if you do have any questions that you would like to ask, please do so by putting those in the chat box. And I will hand over to Somuz.
Okay, thank you, Jill. Thank you very much. Good evening, everyone. It's not the first time I come to IOCP's webinar, but first time as a host probably. We have a absolutely wonderful evening with no other than David Lintonbon, who is one of our course main tutor for acupuncture. So we're going to talk about today about acupuncture for podiatric use. And David, if you could introduce yourself, that would be great.
Good evening. My name is David Lintonbon. I've been a lecturer for nearly 25 years now. Acupuncture is one of our specialisms. My other half is a traditional acupuncturist, and we'll be assisting on the course that we'll be doing in a couple of weeks. So we have an in-depth knowledge of traditional Chinese medicine acupuncture, and also sort of from a Western perspective, the dry needling part.
So shall we start, David, just to know what do we, let us first define what do we mean by dry needling and what we mean by acupuncture and what we mean by Western acupuncture. So 3 questions we have.
3 questions.
Yeah, dry needling, acupuncture and Western.
So dry needling itself is basically inserting a needle without injection into the site of pain. All right, this has an effect on the body by releasing endorphins locally, and of course serotonin distally in the brain, both of which have a pain-killing effect. From a traditional Chinese medicine perspective, we use various acupuncture points, all right, along meridians. So these are actually sort of both in certain areas, which will then sort of, help with pain in other areas, or directly into the site of pain as well, using a local acupuncture point. So that in itself, you're actually sort of working on what we call qi, the life force of the body. So you're trying to sort of create that as a balance. Now, obviously you can't stick needles into everybody, and the precaution here is, of course, the diabetic foot. So we tend to avoid using sort of direct techniques with a diabetic, but you can use more distal points further up the limb or actually sort of other areas of the body. But obviously sort of more of that later. So they're the 2 main sort of, perspectives. Obviously acupuncture has been around nearly 8,000 years. Dry needling has only got sort of, a track record of possibly 100 years at the very most. So both have a positive effect on pain control, not just in the foot, of course, but that's our target area, but in other areas of the body as well.
Why do we call it dry needling then? If it was acupuncture, it said what's on the tip.
Because you're not injecting any liquid. So it's just a needle, a sterile needle going into a point of pain.
Okay, just to be slightly clear, those podiatrists who is on the forum today, there is a difference between dry needling and a verruca treatment. We are specifically talking now is a acupuncture. Dry needling for verruca treatment is totally different concept altogether. It's where we mash the verruca with hundreds of direct penetration of the skin. So basically you will need local anesthetic to numb the area, blah, blah. That's nothing to do with dry needling today. Be specifically clear. We are talking about acupuncture, Western style, and touch about the Chinese or Eastern style, but mainly what David, myself, and David, other half would be doing next weekend would be mainly about acupuncture of the lower limb. So David, if you could explain us the contraindication for the lower limb acupuncture.
Yeah, you've got a number of contraindications. The main one is obviously diabetes. So the diabetic foot, even if you're to stick very fine needles into the foot, the problem, of course, would be sort of you could trigger ulceration. So we don't stick any acupuncture needles into the diabetic foot for that particular reason. But you can, as I say, you could use more distal points. And there are points elsewhere in the body that you can use to ease pain, or if you're looking at it from a TCM perspective, to stimulate qi and circulation in the lower extremity. Any of these where you could get sort of, bleeding, then of course you're not going to do that either. So taking a history to find out what medication the patient's on, very important. Other ones, other serious contraindications would be sort of, if the patient has sort of, an infection, cellulitis. Cellulitis itself is not a good idea to stick needles into. All right, it normally means there is some form of bacterial infection within the body. And of course, this could be spread by the actual needle itself. So that's another one to avoid.
Okay, another one, David, what about needle phobia? I had for the last 25 years, I did get a patient when I was doing a steroid injection, just of the needle phobia. Nothing else, it's not the steroid itself, it's the needle.
Absolutely. Some patients may have sort of, a history of convulsions. All right, so if you stick a needle into a patient, the body is going to react, and as we say, the main reaction is endorphin release, but you are also working partially on the sympathetic nervous system. So you don't want it to trigger any convulsion. So again, you do have to be wary of this. Another one would be sort of, is pregnancy. You do have to be careful here. Various points on the foot, particularly in the 5th digit itself, there's a bladder 67 point right on the 5th digit itself, and if you stick a needle into that, it can create uterine contracture, along with sort of, there's another one, spleen 6, which is just above the medial malleolus. Both of these will cause uterine contracture. So obviously sort of, you don't want to go sticking needles into a woman who's in any stage of pregnancy, to be honest, unless it's really sort of, right at the very end. And then, of course, sort of, there are practitioners who can help with that aspect of pregnancy. But unless you've actually sort of done the complete course, I would say anyone who comes in with pregnancy as such, all right, I would really seriously avoid using any needles at all.
Thank you, David. Another question I get so many times asked. See, I have done also like a medical acupuncture, and I'm also doing acupuncture with you both of. We are partner in the acupuncture course, but both of us have a different way of techniques. End of the session, we will teach them where directly to put the needle in, and all this they learn, they can always treat it, simple knowledge. But the most important thing is that as you're an osteopathic background, as a podiatrist, why do you think that as a podiatrist, we should have that scope within our belt? Or why should a podiatrist have this knowledge of acupuncture?
Well, there's many reasons, really. One is that some people have tissue that is very difficult or sensitive, and you can use it sort of for pain control. So one of the main things people use acupuncture for is that very aspect, is purely pain control. So if there are sort of, MSK issues with the foot, the ankle, the lower extremity, then of course you can use needles to great effect. Also, post-operatively, if you've worked on a patient and there is sort of surgical post-operative pain, that can also be used for easing pain after an operation. So of course, that's your major one, is your pain control aspect. Obviously, sort of, long-term issues with things like sort of, hallux valgus, for instance. We've got a lot of pain around sort of, the great hallux. And of course, you can use the needling to great effect to reduce inflammation and swelling. So this is probably sort of, a very good way of reducing it without sort of, having to resort to serious medication or even further surgery as such. So there's your major answer there. Most people use it for purely pain control.
So it does have a huge benefit in podiatry perspective.
It does indeed, particularly sort of if someone is maybe sort of more sporting. So they may have issues around sort of, constantly straining various ligaments or muscles in the foot, the ankle or the lower extremity. And you can utilize acupuncture in a number of ways. One, you can use it sort of for pain control. If it's actually sort of a ligament sprain, you can use it to reduce inflammation. And if someone's got recurring inversion sprains to say, let's say the ATFL, then of course you can use it to build up collagen and adhesion to stabilize the ligament itself and reduce further injury later on. So it does have a number of connotations there.
Okay, another question would be like next week we are fully booked. So if any other person in here who want to book a course with us, hopefully we're doing next year, we'll be the best option for the practitioner is to put their interest in within the IOCP or put the name forward. So we will know, because it's first come, first service. Unfortunately, this year's we are totally fully booked. We can't take anyone currently. So if you could explain me how sort of treatment we're going to look into next week. And obviously as an IOCP, another thing we will do, we cover up to knee. So we're going to do foot and ankle, the knee, and the legs itself. So if you could break down for me in your own way or own words, David, and I think the audience would probably understand better than me.
Yeah, I mean, obviously what we're going to do is we're going to run through safe needling techniques for that particular area. So from that perspective, we're going to look at sort of, common problems that we see, mainly from an MSK perspective, all right, but obviously sort of, there will be other aspects as well. But one of the big things that we'll be looking at will be the safe insertion of needles to a wide range of people. So when you look at it, sort of, people come in all different shapes and sizes. And as a result of that, sort of, we can then sort of, utilize needling, all right, and how you insert into various aspects. Because, people might have sort of, different anatomy, and they might have injured themselves. So anatomical landmarks may be slightly different. So one of these things is going to be looking at how we actually sort of go about safe insertion of needles, make sure the patient has been assessed so that they're actually sort of suitable for it. So obviously safe needling techniques are the priority, and also safe removal as well. What do we do with the needles once we've removed them? We've all got sharps boxes, so that's one thing that I don't have to worry about with this particular group. So what common conditions do we treat? Obviously sort of, you look at things like Morton's neuroma, plantar fasciitis. You're looking at sort of things like pain generated from hallux valgus, hallux rigidus, post-operative pain. Obviously sort of, if you're actually removing the actual nail itself, then the patient may have post-operative pain problems afterwards. You can actually sort of utilize the needles themselves to reduce pain. Then of course, moving up to the ankle, the ligaments, joint capsule. Obviously if someone's got degenerative changes in and around the ankle itself, then of course you can insert needles to reduce pain in that area as well. Obviously sort of, we have to run through the principles of how this works, and obviously safety is always in the back of the mind. So safe needling techniques, application of where to and where not insert needles. And obviously sort of, that's very, very high on our list of priorities, all right? So we run through, all right, a number of points that we would use, not just into the foot, but also sort of, into the ankle, up through the leg, and obviously sort of follow the meridians of that particular area. We'll run through sort of the theory of how these meridians can be used to great effect. So you're actually sort of utilizing sort of areas that might be sort of slightly above the knee, or actually sort of up towards the hip as well. So if you do the course itself, then of course safe needle insertion, not just into the foot and ankle, but also throughout the lower extremity is quite important. But also one of the main actual sort of techniques that we use is what we call the 4 gates. So we'll actually insert needles into the hand, all right, and foot at the same time. So this is one of our main pain control points that we use. So people come in, they may have quite acute pain. You may not be able to insert needles into the area you would like to, but obviously sort of, there are other areas that you can utilize. And this is something that we'll be doing as well. So we utilize pain control points, not just in the local area, but distally as well. That's they're the main aspects.
Okay, thank you, David. Basically, in nutshell, what we're going to cover is contraindications, cautions, safety, right? Most important, safety, possible side effect, right? And other modality, like needle stuck in, sometimes broken needles. This will be coming under health and safety. The good thing about our course, it's 2 days, it's cramped, it's so practical. So ladies and gentlemen, or pods, whoever you are, get ready for having the needles, right? Because it will be hands-on practicals, right? Total 2 days of almost 16 hours of practical. Obviously, we're going to cover theory because we have to cover theory. So for those newcomers who's not aware of acupuncture and all this, so but we'll try to cover it as proficiently or as in short period of time. So we go into practical. Is that how we're going to do it? All practical based?
Yeah, so obviously sort of, when you put needles into somebody, you want to make sure that sort of, they're going into the right depth. All right, when you put a needle into somebody, how far do you stick it in?
Absolutely, that's an
important aspect.
That's an important aspect.
So on average, you're looking at between 2, 3, 4 millimeters. All right, so it doesn't go in very far.
And somebody like me, I can go into which again with the experience, right? We will teach them, but obviously on that course we will be teaching you more cautionary things. But as you gradually improve your technique, improve your proficiency, or do extra courses, it's just many possibilities, right?
There are indeed, and what you tend to find is, we teach this on a regular basis. Other aspects that we do. This is a specialism acupuncture course for podiatrists. So
yes. Therefore we will be doing. David will show his technique. I'll show 1 or 2 technique of plantar fascia, how to reach the fascia by pull and push technique, or 1 or 2 when we have the time at the end of the day. We will show 1 or 2 advanced version of it. Sometimes we always share that, but it's about finding time because it's so practical. God knows how quickly that 2 days goes.
Time flies when you're having fun.
Yes. And another questions. Again, many practitioners ask when they see on the TV, they see on the YouTube that people are putting thousands of needles.
Yeah.
Right. Can you explain that? We don't, one good enough needles can do the much better the job.
When you look at some of these things, obviously it's just done for show. Obviously, sort of, we're doing it sort of, for people's medical health. So, difference there being that we're focusing on that patient's particular complaint. So if you've got, say, an athlete who comes in, or even sort of, a member of the general public who's a bit of a weekend warrior, can sometimes get things like shin splints.
Yes.
And shin splints themselves, if they're not dealt with properly, they can lead to all sorts of issues. there you would possibly pop needles in just that little bit deeper, and you're going underneath usually the posterior part of the tibia. So the actual sort of needle itself has you've got to maintain aseptic technique, because if you are going in deep, you're going into the periosteum, for instance, then of course sort of, you know, you have to make sure that your technique is very good indeed. So usually the one for shin splints we leave to day 2, because obviously we're developing people's new skills. And
we go slightly advanced level on day 2, don't we?
That's correct.
Okay.
So once people get proficient at popping needles in, obviously you're only going to teach this to people who are proficient at this, because most people would have a good knowledge of the area, anatomically, physiologically, and pathologically. So from that perspective, it's a question of getting to pop the needle in where it needs to go. And that, once you've got the concept of inserting needles, you know, people really are straight in, and they want to do more and more. So you've got to rein some people in. Say, look, you know, you can only put so many in at a time. All right?
Okay.
So
Okay, David. One question Tony Monday asked. He's my friend, by the way, Mr. Tony Monday.
Uh-huh.
All right. He asked, this might be a more advanced question, but is it possible to use dry needling? Don't say dry needling, David Monday. I don't like that word. Acupuncture, we are podiatrists, right?
Yeah.
Alternative to analgesic for ingrowing toenail operation. I don't think so.
Well, I think, you know, if somebody's got sort of, you know, pain from that, as I say, you could then use the techniques to ease the pain, which I dare say you would use it pre-operatively, remove the needle, and then post-operatively.
Okay, so what you mean, I think I understand what my friend is meaning, because I've seen it on television, right? In China, they're using acupuncture to numb or put people to sleep. I don't think so we would be covering that.
Well, we won't be doing that, but I mean, you know, people do. And,
yeah,
you know, when you
but
look at
it's knowledge, it's deep knowledge, that is.
It is. I mean, there's 654 acupuncture points in the body, 12 meridians, 8 extraordinary meridians, and then you've got your extra points as well. So getting to grips with all of those, you know, is a bit more than just 2 days. But what we find is it really opens people's eyes to a completely new form of pain control, but also sort of, you know, helping with various other conditions. And a lot of people, once they've done the 2-day course, they might be interested in then going on and doing the complete course of needling points throughout the body. So this is something we can look at as a basic.
A traditional acupuncture course is almost 5 years, isn't it?
It's between 3 and 5 years, depending on where you go. So 654 points is an awful lot. Each one has many connotations. So not only have you got your MSK aspect to it, but there are also other aspects to it as well. And, you know, we do look into sort of some of the other aspects around it, because you have to be aware that when you're putting in points, as I say, that bladder 67 point in the little toe, it's very good for easing pain in the lateral aspect of the foot, metatarsalgia, and so on. But it can also stimulate uterine contracture. So you have to be aware of this as a contraindication. Obviously, you're treating male patients, it doesn't make any difference. But obviously, sort of, you know, we have to be aware that there are other aspects to this. And, you know, you could have some serious consequences if you start putting in needles and you don't know what the contraindications are. But we list them all, don't we, Somuz?
Yeah.
Long list of contraindications.
Long list, yeah. I frighten them. I frighten them away. But then again, we are practitioners anyway. We are more cautious than anything else. Okay, one question. Well, one question from Kirsty about length of the needles and thickness of the needles. Does that make any difference, or are each needle size length? Is it for specific purpose or specific treatment?
It's a very good question. I mean, obviously
Thank you.
there are standard needles. So normally they're 0.25 by 30 millimeters. All right, so they're the standard ones. But when you think about it, if the needle's only 0.25, it could easily bend. So you might have to then go up to 0.28, 0.30, or even up to 0.35. But remember, the thicker the needle, the more you're going to feel it. All right, so you do have to use a thicker gauge needle if somebody has got quite tough skin. Some people have got sort of, you know, scarring or fibrosis, and of course you've got to be able to go into that. So then you would use a slightly thicker needle. So you do have to have a selection. But most of the time we'll be using 0.25 or 0.28 by 30 millimeters. All right, so standard needle. I haven't got one here, but still.
Yeah. Do you want to?
We'll get a needle. We'll show you.
Okay, but we would be using mostly the standard 1 millimeter thing, because that would be what we're going to be training whole weekend. And good news is that I've been kind with them. I'm going to give them fresh one box needle for them after the course, for them to take away with it, right?
Excellent. I think one thing we need to point out, Somuz, is where you buy your needles from. All right, now you can buy needles anywhere. You can go onto eBay, you can go here, there, and everywhere. But how sterile are they?
Yeah, okay.
See, this is the thing. There are sort of, you know, unfortunately unscrupulous people out there, and so we have to be careful. So we tend to use a company called Acumedic, which is based in London. Been there sort of, you know, 40 years. All the needles are sterile, and as you can see, here's the standard sort of, you know, measurements as such. I don't know whether you can see that on the camera.
Yeah, we can, but obviously we'll show them. We'll show them more on that day.
Yeah. Then if I get one of the blister packs out, you can actually sort of see.
Okay. Well, again, my friend is asking another question. Oh yeah, there you go.
There you go. These are the standard needles. They're 0.25 by 30 mil.
Okay, my friend is asking questions, right? The issue I have sometimes is making sure that I have located the correct spot to the needle. Can David or Somuz share their knowledge on how to select the right point?
It's very true. So
good questions. We're getting good questions today.
People are given a book of the points. So what Somuz and I have done, we've put together sort of, you know, a booklet on podiatric acupuncture. So all delegates are given a booklet with all the points. So literally all the books, there we are, he's got it there.
Not only that, the brilliant about the IOCP, because I designed the course, we are also giving them USB.
Yeah.
USB, the booklet, and they're getting 2 booklets as well.
That's it. Got a booklet of all the points, all the contraindications, theory, principles, practice. And of course, locating the points, of course, is actually sort of very important. So a knowledge of anatomy here is incredibly essential. So what we ask people to do prior to the course is just run over the anatomical landmarks. Just get familiar with those anatomical landmarks again. It might be slightly different to what you normally do. So that's one thing that we're quite hot on, aren't we? So was the anatomy of the area.
Absolutely. Also, I made, and I'm going to give them in their pack, I made a leaflet. Right. So it's going to be in their pack. So they just need to change my Foot Medic logo, and they put their own logo. It explains what is medical acupuncture, what are the benefits, is acupuncture safe, how many needles will be used, how many treatments are needed, does acupuncture have side effects, and is there anything your practitioner need to know beforehand? Single-use sterile disposal needle are used by practitioners. So all the leaflets for them. So every packet, the whole packet for them, they can just go Monday morning and start practicing. So
That's correct.
So basically medical acupuncture mean referring us to the acupuncture needle as a therapeutic techniques compared to orthodox, right? Whereas Chinese acupuncture is traditional acupuncture. It's too different, right? Medical acupuncture based on our medical knowledge and so on, and also explains about benefit, general benefit of acupuncture in podiatry field, and it's one of the safest modality, I believe, right? In podiatry perspective, right? Is this covered by our insurance? Absolutely. If you are an IOCP members, the only organization probably on planet Earth, right, which covers up to the knee, and also the IOCP's course is only open to statutory regulated profession, right? That means a podiatrist, osteopath, chiropractor, physios, nurse, doctors, right? Only to statutory regulated healthcare professionals, because acupuncture is an advanced technique and you need to know about it. The beauty about podiatrist, we are already competent and we have a proficiency within our undergraduate education by using local anesthetic. So we inject before we even get qualified, right? So at undergraduate level, we do injection therapy, pump certificate. So therefore, we are far competent to do the training on the lower limb, which we have the knowledge of.
Correct.
Okay, so let's talk cost and charge. As a podiatrist, what can you charge versus other treatment? What is the length of the treatment time versus alternative? So first of all, the length of the treatment, I'll ask David to ask that. On the podiatry perspective of how much we charge, again, depends on the practitioners and depends on how you integrating the acupuncture. For me, I charge acupuncture separately. I have a consultation, initial consultation fees. If I see it's deemed necessary for them to have acupuncture and they agree on acupuncture, we also give you a consent form. It's in your packet. Consent form is there in your packet, right? So normally I charge my standard podiatry fee for half an hour session. So I would say whatever your standard half an hour fee for your podiatry treatment, like basic podiatry treatment, removing hard skin, corner callus, I would put same for acupuncture of lower limb, right? Half an hour session. Now, David, the question would be, what can you know? What is the length of the treatment time versus alternatives?
So that's a very interesting question. It really does depend on what the patient comes in with. Most of the time when we pop needles into a patient, they're only in there for about 10, maybe 15 minutes. So we look at it from a slightly different perspective. Our treatment sessions are half an hour long, and normally we will use, obviously, some acupuncture in part of that treatment, not always, but a lot of the time we do. And then while the needles are in, we're working on a different area using manual therapy techniques. So we may have a slightly different approach to you guys. But normally needles are in for about 10 minutes.
Yeah, and as I say, once you come into the course next week, you'll understand far better when you see something live face-to-face.
Yeah.
And you can explain far better, or if we cannot explain it now, when you see something, you know, it's what you call see one, do one, teach one. Remember that word?
Yes.
So that's certainly. Look, like David has answered. I am writing the questions. All right.
Yeah. So that's to tell you how long they stay in.
As some say 20 minutes, others say less than, more than. Okay, how long? For me, I'll ask, David can answer himself. I put it half an hour session. So half an hour session, if I put needle in, probably 20 minutes or 22 minutes. You know, it's what you think, David. That's my friend Tony is asking. How long you should keep the needle in?
On average, about 10 minutes.
Thank you.
It does depend on the actual length of the the problem that the patient has. If something's more chronic, then of course you might leave them in maybe a little bit longer. If something's quite acute, you might leave them in longer still. But then there are other aspects to acupuncture as well. If someone's very acute and you want to stimulate more endorphin release, you might want to connect them up to a TENS machine as well.
We're going to talk about that.
Yeah, so there's other aspects.
Okay, let's, before I forget, another alternative, right? Currently, David, I am using, and you should now advocate that, my friend. I am using combination with acupuncture and class 4 laser.
Right.
Class 4 laser, as you know, it's very high powered laser. It gives heat, right?
Fantastic.
So that's something I will possibly, and I think one or two of my colleagues coming into our course, they have the class 4 laser, and Abid Place, he's also got class 4 laser. We may, if we have time, in our last session, we may show them how combination is far effective sometimes than standard.
We'll have to bring our TENS machine as well, and we could wire a few people up.
Yeah, somebody, yes. Helen Helen is coming to the course, and we will show you. If Helen, if you, we can probably actually do far good demonstration on
show herself. Hello.
Yeah, laser with acupuncture.
Right.
Yeah, that's something we could.
It is. I mean, obviously, sort of, we're in the 21st century, whereas if you go back sort of, 2,000 years. The same thing would have been done in a way with the burning of moxa on the end of the acupuncture needle. It creates the same thing. You're creating heat. That heat itself can be up to 200 degrees. So, moxa itself is the herb mugwort. You can actually sort of burn it on the end of the needle. The longer you leave it on, the hotter it gets. And some practitioners do actually do this to create scarring in a particular area. Now, this is obviously something that's done in TCM, but however, you can see that sort of, a similar thing, you're using heat to actually sort of stimulate endorphin release. And obviously with the laser,
we got about 5 minutes, then we'll wrap it up, hopefully. It's everybody, so. Yeah. Another question, my friend was asking, how long you keep it up? David said 10 minutes, I said about 20 minutes, against your own discretion. But what I do, right, I will go after 5 minutes and just prick. Right, so after a few minutes later, I'll go back to the patient and just push. It helps. I believe that also helps a lot. What do you think on that?
Well, it does. There are a number of schools of thought here.
Okay.
Some people would say that sort of, just stick the needle in, take it straight out. All right. You've actually sort of created micro tissue trauma, which is good enough for endorphin release. However, other schools of thought are if you leave the needle in, you can then stimulate further endorphin release or stimulate further chi by actually sort of working the needle itself and actually sort of work it so sometimes the patient feels a bit of discomfort. All right. But obviously sort of, you have to gauge this compared with what the patient is coming in with, and also sort of, the patient themselves. I mean, some patients don't have a very good pain threshold. You've got to be very careful with this.
Thank you.
So,
yeah.
One
more good question before we wrap up is next aspect is trigger point. What are the knowledge of how to effectively locate? You made it on the book, anyway. Basically, he's asking
trigger point itself.
What are the knowledge of how to effectively locate trigger points? We got that in the book, isn't it? Your book.
Yeah, a trigger point is basically an acupuncture point. All right. If you look at sort of certain sort of points on the body. All right, I'll just bring some up on the screen here. Now, a lot of people use trigger point therapy, but it's like most things, they've basically taken it from traditional Chinese medicine and just called it something else. All right.
Well, I was taught, David, where there is a pain, you stick the needle in.
Absolutely. All
That's basically I'm going to teach you end of all next week. When David finished, I said, that's it. After 16, 17 hours, simple knowledge, where the pain is, put the needle in.
Exactly. Just gonna go and just go back to that. I just want to look at something here. Right. Okay. So let's take a standard point. All right.
Yes,
So if
yeah.
we go to the hand.
Yeah.
Right. Now, a lot of people sort of, look at this point here, and they'll stimulate this point. All right. If they've got a headache or they've got travel sickness. All right. Now, a lot of people might know this already. Do it, find it helps, but they don't know why. All right. To just do it. Now, locating that point itself is very easy. All right, because you can actually sort of find in between the first and second met, and then we come sort of together. You bring the mets together, and you can find there's a slight crease there. All right, so this crease itself, all right, is really the large intestine 4 point. All right,
Is that the one?
Somuz has got it there. You see,
that's in your booklet.
Fabulous.
All the basic trigger point is on the booklet.
Sorry, I can't do a screen share.
Yeah.
But yeah. So this is a large intestine 4 point. To some people, it's a trigger point for headache or a trigger point for nausea or travel sickness.
Thank you, David. Thank you.
How do you find it? Well, you just work into it. You'll feel most of the points actually have a slight depression in them. So when you run your finger over them, you know where they are, and they're all related to the local anatomical landmarks.
Thank you, David.
This is something we point out.
Thank you. Basically, to wrap up again, what we're going to cover on next weekend for 2 days of intensive practical course on acupuncture biomechanics, up to and including the knee. And David has a few tricks he's going to show you. He's going to show you the start of the knee. I live that.
That's it. Yeah.
Unfortunately, end of the day, there is a little bit of assessment because we need to know whether you understand or not, right? We're not here to fail you, but there are a little bit of assessment. You're just going to show us a bit of technique and hopefully
in your assessment.
Yeah, in your assessment. So we're going to cover the knee, right?
Yeah.
The whole knee, right? Anterior lower leg pain, right? We're going to cover lateral leg pain, right? We're going to cover calf pain. We're going to cover Achilles tendonitis or Achilles tendon. We're going to cover plantar fascia. We're going to cover motor neuroma. We're going to cover what else, David, of the lower motor neuroma, any ligament pain.
Yeah, it's exactly the ligament pain itself. But one of the most important things is where do you put the needle? Just basically to ease people's pain. That's the thing. I mean, a lot of people have foot, ankle, and lower extremity pain, and of course, that's our job to try and ease that pain for them and keep it at bay. So you can teach people to use trigger points themselves, all right? Because basically, it is just an acupuncture point. So you can teach your patients how to ease their own pain. Are we doing ourselves out of a job?
Any last advice or David, or quick message?
Acupuncture has been around a long time, so a lot of practitioners find it helps to use this as a pain control method, right? You're not injecting any fluid, and also sort of it's a very safe and tried and tested method. So come along. See for yourself.
One question was, can a Baker's cyst be used as acupuncture?
I would say you can ease the pain of a Baker's cyst, but you're not going to
penetrate it.
with it.
Yeah.
I'll leave that.
How long does pain relief usually last? Again, it all depends, isn't it?
Yeah, sometimes.
How long is the stream?
Yeah, sometimes it lasts sort of a couple of hours. Sometimes it will last for more. Sometimes the pain goes completely.
Again, those who's attending the course bring all this question or all this complication you want us to show on that day. I'm sure we'll find a way to treat it. Thank you, David. Yeah. Thank you for coming to the show. Thank you for your time.
Absolute pleasure.
And thank you for those who actually joined us. I'm sorry we had to wrap up because David times our time. So wishing every one of you who joined it. If there's any question, you can always ask the IOCP and they'll get back to you. If you want to come to our course next session or next year, please book in advance because we only take 12. Again, we only take 12. And if you put your name forward or register your interest, then first come, first service, hopefully by next March. Is that okay with you, next March?
Next March is good. If
Okay.
we're still alive.
By the way, we also have the mobilization course, almost full, next November with day-to-day.
Yes.
So if you want to learn about mobilization, it's another high skill technique we should all have in our knowledge.
That's right.
Thank you, everyone. And have a lovely evening. If I have
Thank
said
you all.
something wrong, or we have
Bye-bye for now.
passionately something we misrepresented, please forgive us. It's a live session. There is no script. Thank you and goodbye.
See you all soon. Bye-bye for now. Have a pleasant evening.